Hi, welcome back to the GlutenFree RN podcast. I'm Nadine. Welcome to episode 18. Today we're going to talk about the relationship with non-celiac gluten sensitivity, celiac disease, with Down syndrome, Turner syndrome, and Williams syndrome. Join me today. This is going to be a fascinating episode, and I'm very excited to share this information with you, especially if you have anyone in your life that is affected by Down, Turner, or Williams syndrome. Stay tuned. Hi, and welcome back to episode 18 of the GlutenFree RN podcast. I'm Nadine Gruskowiak, RN, BSN, CEN. The CEN is Certified Emergency Room Nurse because that's what I did for the first 17 years of my career. For the last 10 years, I've been trademarked as the Gluten-Free RN, and I am a celiac expert. Today on episode 18, we're going to talk about Down, Turner's, and Williams syndrome. This is a very important topic, especially if you have anyone in your life that is affected by any one of those syndromes. We all know people that have Down syndrome, Turner syndrome, or Williams syndrome. Some people might not actually know that. Some of these people are extremely high functioning and they get around great, and other people suffer quite a bit. So this is a very important topic to cover today from my vantage point as a nurse, because I am a patient advocate, and it is extremely important that we look out for our vulnerable populations. And anybody with a syndrome or any type of disability or altered ability needs to have an advocate or someone looking out for them. And that can be a parent, it can be a sibling, it can be a healthcare provider. It's many different people depending on the community that you live in. And hopefully these people have a vast network of people supporting them in their daily lives and with their activities of daily living so that they can enjoy life to the absolute fullest. The interesting thing about Down syndrome, Turner syndrome, and Williams syndrome is that there is a high prevalence of non-celiac gluten sensitivity and celiac disease in these populations. So it has been recommended for a number of years that everyone in these populations get tested for celiac disease every year. I can assure you as a nurse and someone that has worked in this very specific field for a number of years, I can assure you that these people do not get tested every year, let alone ever. So it's extremely important that there's a high index of suspicion because a lot of these people suffer from a number of signs or symptoms that could be alleviated by going on a gluten-free diet. If you've read my book, Donation, a nurse's memoir of celiac disease from misdiagnosis to food and health activism, you may recall that I wrote about Tiffany. And Tiffany is a very good friend of mine. She's lovely, but she also has Williams syndrome. She was born with it, and it is a chromosomal kind of wackiness that gives her some short stature and some interesting facial features. And for some people, it makes them extremely musical, but not Tiffany. Tiffany is much more interested in sports. So some people get very focused on different aspects of life. And for Tiffany, that's sports. And for some people, that's music. So Tiffany was pretty sick when I met her several years ago. She had stage 4 liver failure. Her diabetes was out of control. She had a really high HbA1c, which is an indicator of how high blood sugars are over time. Her skin was horribly cracked and bleeding, painful. And she had, because of the stage 4 liver failure, she had ascites, which means she was carrying around a lot of fluid in her abdomen. So she looked like she was pregnant, but she wasn't. I, as an emergency room nurse, made sure. And we did get her tested for celiac disease, and lo and behold, she came back positive, but nobody had ever tested her before. So really what it takes sometimes is just the suggestion that people get tested for celiac disease. And of course, that very simple suggestion and then the diagnosis of celiac disease actually changed Tiffany's life. She no longer has stage 4 liver failure. Her diabetes is well under control, and several other signs or symptoms actually cleared up, went away, disappeared, resolved, and she is much healthier now than she was certainly when I met her. Trust me, Tiffany still has some medical difficulties that we work with every day, but as long as she doesn't get exposed to gluten, she remains extremely healthy and is able to attend many sporting events, which is her passion. She loves that. So if I can do anything to allow Tiffany to enjoy her life as much as I enjoy my life, well, then that's my job. That's what we do. So I have an obligation as a nurse to, number one, do no harm, and to also protect the people that are in the vulnerable populations. Tiffany would fall into that category, and so I am pleased and proud to say that just simply asking for a test for celiac disease, helping Tiffany get that diagnosis, has led to increased quality of life for Tiffany. There's a number of studies that show that incidental screening for celiac disease in Down syndrome patients reveals that there's a high incidence of celiac disease or non-celiac gluten sensitivity in these populations. So one specific study is entitled Screening for Celiac Disease in Down Syndrome Patients Revealed Cases of Subtotal Villus Atrophy Without Typical for Celiac Disease HLA-DQ and Tissue Transglutaminase Antibodies. So really, these people have gut damage, but it wouldn't be found with the standard blood test or HLA-DQ2 or DQ8 gene testing. A lot of these people are actually testing positive for the AGA antibody, which is the anti-gliadin antibody. Many labs, unfortunately, do not test for the AGA or the anti-gliadin antibody anymore because it's considered to be non-specific for celiac disease and too sensitive. Now, I have a little bit of a problem with that. Number one, it is an excellent biomarker for non-celiac gluten sensitivity. So even in the absence of celiac disease, many patients have non-celiac gluten sensitivity or are sensitive to grains or wheat or barley and the proteins that are in there. One of those proteins being gliadin. So here we have a test that is actually testing for the body's reaction to the gliadin protein, and it's an anti-gliadin antibody. So when I gave a lecture several years ago on Down syndrome, Turner's, and Williams syndrome, I noted that there was a study out there that showed that they had actually tested the blood of these people for celiac disease, and 50% of them came back positive with an AGA antibody. That's 50% of the subjects in this study had positive antibodies against gliadin, or the gluten protein. Do you know what they did with that information? They threw it out. They opted not to actually tell these people, this vulnerable population, that if they stopped eating grains, they might improve some of their symptoms. Ethically, that might be a problem, and I hope at some point it is. In this particular study, the screening for celiac disease in Down syndrome patients, the results showed that 41% of the Down syndrome patients had AGA antibodies or anti-gliadin antibodies. They also found that some of them were IgA deficient, which means they did not produce enough antibodies or IgA antibodies to actually mount an antibody response to have a positive test result. So they did do the biopsies on these patients, and what they found was that the incidence of celiac disease in this particular population was 3%. There's other studies that I have right in front of me that show that celiac disease reaches incidence or prevalence of up to 15% in these populations. So it's extremely important that anybody with Down syndrome, Turner syndrome, or Williams syndrome get tested for celiac disease. If not, prophylactically put on at least a gluten-free, dairy-free diet. And hopefully it's considered that a whole food diet, or what some of us refer to at times as like a paleo diet. Food is medicine, and we really do have to approach food that way. Now, unfortunately, the people with Down syndrome in my town, most of them, or very many of them, actually work at a bakery, a flour-based bakery, a wheat flour-based bakery. I have a problem with that because I actually know that several of them are celiac. They were diagnosed celiac. And so do we not have an obligation to protect these people? Maybe they could open up a gluten-free bakery instead of a wheat flour-based bakery. Their cakes and their cookies are fabulous. When I was still eating gluten, when I didn't know I had celiac disease, that was always the first place I would go to order birthday cakes and get some baked goods and whatnot. Now that I know what I know, I can't pretend I don't know what I know. And so I would say that those people are at risk, of course, from environmental exposure, not just because they work there, but they're breathing that wheat flour and they're getting it on their lips, they're licking their lips. So there's lots of exposure opportunity while they're working in a flour-based bakery. Again, if our obligation is to protect people, we really do need to make sure that these people are in a safe environment. The other interesting thing is that what we find is that because some of these people are actually HLA, DQ2, and or DQ8 gene carriers, these people with Down syndrome, Turner syndrome, and Williams syndrome, that the entire families have to be tested for celiac disease. Here's another canary in the coal mine. If a mom is potentially malnourished and having difficulty during her pregnancy and ends up having a child with Down, Turner, or Williams syndrome, it should be asked why. What's going on? What's disrupting the development of the fetus? Genetically and epigenetically. I've mentioned before that the Kennedy family is looked at as to potentially having celiac disease. That JFK himself probably had celiac disease and is hopefully being tested. Some of his tissue is hopefully being tested posthumously to determine whether the Kennedy family actually does have celiac disease. And if you remember way back, JFK had a sister who had Down syndrome. So I would not at all be surprised if the entire Kennedy family, being from Ireland, highly at risk for celiac disease, did in fact have members of their family that were celiac. Here's another great study entitled Prevalence of Celiac Disease and Down Syndrome. It's from the European Journal of Gastroenterology and Hepatology. It's dated March of 2001. And it says that 18 of the 284 subjects with Down syndrome between aged 2 and 15 years, celiac disease was confirmed by jejunal biopsy at a rate of 6.3%. So that is much higher than the other study. Here's another study that just says that everybody with Down syndrome should be screened for celiac disease. It is recommended. Children with Down syndrome should be carefully examined in their follow-up, and celiac disease should be considered in cases of growth retardation. IgA anti-gliadin antibodies and the EMA test are non-invasive, cheap, and readily available. So these people should be tested because in this study they did have it actually says 11 of the 47 patients were found to be serologically positive. That means that they had positive blood tests. Now, I'm sure that you remember when I said that one blood test never rules out people for celiac disease because they can seroconvert at any time, which means that once a person whether they have Down syndrome, Turner syndrome, or Williams syndrome, is tested once, that does not rule them out from ever developing celiac disease. That's why they have to be tested every year, even in the absence of symptoms. Several of these people that were tested in these studies really reported no symptoms, or their parents would have said, hey, they don't have any symptoms. They're perfectly normal for somebody that has Down syndrome, Turner syndrome, or Williams syndrome. And sometimes I think we just assume that people with syndromes are supposed to have certain symptoms because they're so well reported, such as diarrhea, abdominal pain, gas, bloating, constipation, short stature, brittle bones, osteoporosis, osteopenia, anemia, type 1 diabetes, thyroid issues. You get the picture. The list goes on and on. So even just failure to thrive, what does that mean? That means that sometimes these kids are falling off the growth chart. They usually have decreased appetite. Some of them have the skin rash that goes along with celiac disease. And unfortunately, sometimes it's considered to be normal to have a skin rash with Down syndrome, Turner syndrome, or Williams syndrome. What if that rash is actually DH or dermatitis herpetiformis? And that rash is extremely painful and itchy. So it would be beneficial to these people with Down syndrome, Turner syndrome, and Williams syndrome to be tested for celiac disease so that potentially those symptoms can go away or resolve or get better. And I do work with a fair number of people that have had yeast overgrowth or been diagnosed with lichen planus in their mouth, on their skin. And once we start a gluten-free diet, those skin issues go away. And those skin issues can actually cause the decreased appetite or the difficulty swallowing or any number of other issues. So it's extremely important that anybody with Down syndrome, Turner syndrome, or Williams syndrome get tested. And I've worked with a number of people that have been severely autistic and have had any number of developmental delays. Some people that have been very pleasant and are very sweet and kind and everything, but some people actually will have to wear helmets because they hit their heads on walls and or furniture or whatever repeatedly. And to me, that is potentially preventable. I had a sweet gentleman who actually was in a group home, lived with a bunch of other people that have had developmental delays, and he had severe autism and diabetes and repeated infections, all types of things. Once we put him on a version of a paleo diet or a whole food diet, he actually improved. He did not feel compelled to hit his head against the wall or self-abuse or even act out sometimes. He was actually calmer. His demeanor was more pleasant. He liked the food that he was being fed, and it wasn't as difficult for him to eat. It didn't irritate his throat as much. So unfortunately, this gentleman did pass away, but the remaining years of his life were quite pleasant. He enjoyed his work. He liked to go out. He enjoyed everyone else's company, and his quality of life was improved. And one of the number one goals I have as a nurse is to make sure that everyone's quality of life is as high as possible. That is the point, isn't it? Here's another great study from the International Journal of Pediatrics, and it's from September of 2014. It's entitled Asymptomatic Celiac Disease in Children with Trisomy 21 at 26 months of age or less. So these are toddlers that we're talking about, less than 2 years of age. And what they're finding is in this particular study that they are recommending that they get tested for celiac disease. So the discussion in this study is that children with Down syndrome are at high risk for many medical disorders such that an organized approach to management is indicated. Congenital heart disease and vision and hearing disorders are very common, so all children with Down syndrome are evaluated for these. Screening of children and adolescents with Down syndrome from multiple countries identifies biopsy-proven celiac disease in 3 to 9%. This is probably an under-identification, as studies do not routinely include children already identified with celiac disease. Also, not all children with positive screens have a biopsy. This could be due to some children with Down syndrome and positive screens being asymptomatic and therefore not pursuing a biopsy. If they have positive antibodies, these kids have damage somewhere, which means they have celiac disease. The University of Chicago will say that if you have a positive TTG and a positive EMA, then you have damage somewhere. You have celiac disease. The study further goes on to say there's been a lot of discussion about screening for celiac disease in all children with Down syndrome, whether they are symptomatic or asymptomatic. In our 3 asymptomatic children with DS in this study, on a gluten-free diet, one gained weight and was much happier and energetic, and a second child had less constipation and diarrhea. So were they really asymptomatic? Another issue is the cost of screening, with one study estimating a cost of $500,000 of screening and biopsies per year per life year gained. I think that's a high cost estimate, number one. I don't know what to say about that. I can't imagine that the cost of screening for celiac disease is $500,000 per life year gained. I'm going to have to look at that again. If you want to look at this study, you're more than welcome to. I'll put it on as a reference. Untreated celiac disease is associated with the development of symptoms such as weight loss and poor weight gain, abdominal discomfort, bloating, large stools, constipation, and diarrhea. Long-term complications of untreated celiac disease include anemia, intestinal lymphoma, and osteoporosis. We mentioned all those earlier, didn't we? Initiation of treatment prior to identified symptoms might prevent the development of these problems. One prospective 10 years follow-up study of 32 children aged 2 to 4 years with celiac disease and Down syndrome reported good compliance, which means that their parents and their families and their caregivers were actually providing them with actual 100% gluten-free food. They determined that 66% had health improvement without a deterioration of health-related quality of life. They stated that delayed treatment for children without symptoms after a positive screening test may be an option, but needs long-term follow-up study. I would say if a person has a positive test, they need to go on a gluten-free diet, especially in the vulnerable population. That's our job, is to make sure that we're making sound decisions based on the information we have regarding a vulnerable person's health. It's very important that these people are taken care of, whether they're a child that has Down syndrome, Turner syndrome, or Williams syndrome, or any child. Any child actually fits into a vulnerable person category, because they rely on us as adults to make very wise decisions regarding their health, not just as children, but hopefully for their long-term health. So just in review, it is highly recommended that anyone with Down syndrome, Turner syndrome, Williams syndrome get tested for celiac disease every year. And if that's too much, if people don't want to do it, please be aware of the signs or symptoms related to celiac disease. Don't just assume because someone has Down syndrome, Turner syndrome, or Williams syndrome that they're going to have diarrhea, constipation, short stature, bloated, belly pain. Those signs or symptoms all are affecting their quality of life. And we really need to be aware that if celiac disease is the cause of those signs and symptoms, that potentially we can alleviate their pain, suffering, and discomfort by simply changing their diet. If anybody has any of those syndromes in their family, the entire family should be tested for celiac disease. It's always just good practice. Again, it's very important that we are all actively protecting our vulnerable population. And I write in my book, some days I think that's all of us. I think all of us at some point in our lives are part of a vulnerable population. Nurses, doctors, caregivers, anybody that comes into contact with people with any type of vulnerability, we really do need to speak up for them and make sure that their needs are being met. And if one of the simple things we can do for them is test for celiac disease, well, that needs to be done. So speak up for someone in your life that needs to be tested for celiac disease. In an effort to raise their quality of life and give them less symptoms to worry about, less symptoms to deal with, and hopefully a higher quality of life. This has been episode 18 of the Gluten-Free RN. I'm Nadine Gruskowiak, the Gluten-Free RN. Happy to be with you talking about the effects of gluten on people with Down, Turner, and Williams syndromes, and why it's important for us to be hypervigilant and have a high index of suspicion for any of these people that have these disorders or these syndromes to get tested for celiac disease. It's a very simple lifestyle change, a diet change, which eliminates gluten and hopefully dairy, that potentially allows them to get significantly better. Thank you for joining me, episode 18. And I'd also like to say thank you very much to the people that have rated the Gluten-Free RN podcast on iTunes. I really appreciate it. If you take a few moments and just do a quick rating and maybe write down a few comments. It gives me a lot of information and some valuable feedback and helps with future episodes of this particular podcast. I do read them. I think they're very valuable, and it helps me to know that people are listening and they have thoughts and opinions about what I am talking about. A huge shout out and thank you to Tim Hellewell of The Podcasting Guy for being my executive producer and editor for this podcast, and also to Pulse Media Network, my distinguished group of friends who are also healthcare podcasters, such as Elizabeth Scalia, Kevin Ross, and Keith Carlson. I really appreciate all of the support and the comments and the constructive feedback and all the information that they gave me so that I could actually start this podcast. That wraps up episode 18. There's a lot of information in there. I hope you found it helpful. And if you save one person or help get a person recognized that has Down syndrome or Turner syndrome, but also has celiac disease, I applaud you. Thank you very much, and look for somebody else. Until next time, again, this is episode 18 of the Gluten-Free RN podcast. Thank you for joining me. Go live life to the fullest, have a high quality of life. Look for people that may be suffering from non-celiac gluten sensitivity and or celiac disease itself. Be courageous enough to speak up. And for everyone, if you think celiac disease doesn't affect you, your family, and your friends, think again. Happy day. Until next episode, this is Nadine Gruskowiak of the Gluten-Free RN. Bye.